Pharyngeal pouch, also called hypopharyngeal diverticulum or Zenkers Diverticulum. It is a pulsion diverticulum where pharyngeal mucosa herniates through the Killian's dehiscence, a weak area between two parts of the inferior constrictor. Etiology. Exact cause is not known. It is probably due to spasm of cricopharyngeal sphincter or its incoordinated contractions during the act of deglutition. It is usually seen after 60 years of age. Pathology. Herniation of pouch starts in the midline. It is at first behind the esophagus and then comes to lie on its left. Mouth of the sac is wider than the opening of esophagus, and food preferentially enters the sac. Clinical features. Dysphagia is the prominent feature. It appears after a few swallows when the pouch gets filled with food, and presses on the esophagus. Gurgling sound is produced on swallowing. Undigested food may regurgitate at night, when patient is recumbent, causing cough and aspiration pneumonia. Patient is often malnourished due to dysphagia. Patients with pharyngeal pouch may have associated hiatus hernia. Rarely carcinoma can develop in long-standing cases of pharyngeal pouch. Diagnosis. Barium swallow will show the sac in its size. Treatment. 1. Excision of pouch and cricopharyngeal myotomy. This is done through cervical approach. 2. Dolman's procedure. The partition wall between the esophagus and the pouch is divided by diathermy through an endoscope. This is done in poor-risk debilitated patients. 3. Endoscopic laser treatment. It is similar to Dolman's procedure. Partition between the pouch and esophagus is divided by CO2 laser using operating microscope.